not a billboard.
In some of the meetings, we began with snarky 5 minutes, where we all just threw out really snarky things we'd never use, and it was excellent for our psyches. So I will point out that in addition to the signs being picked up all over rural Michigan, state of Florida picked up our signs, and so we did get some national exposure as well.
Yes, okay, so this is at the very end, and that was the digital billboard out by the
Turtle
Creek Casino. And this one said, they're all Great Lakes, keep them clean. And then the last one said, vote early, vote awesome. So the digital billboards were our last stand. And it was an exciting project. I think people should definitely consider doing it again and starting early to book the billboards through Lamar.
Right.
Thank you guys so much. I appreciate so much your work. And now John Hunter is going to introduce Lisa.
Okay. At our first meeting in January last year, I had the honor to introduce Lisa Peacock. Lisa is a board member of the Share Care of Leelanau, which promotes independent living for seniors in Leelanau County. She also serves as the health officer for the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Lisa works tirelessly to identify opportunities that involve regional collaboration and intervention. She serves as the vice chair of the Northern Michigan Public Health Alliance, which was selected as the backbone organization for the Northern Michigan Community Health Innovation Region, and has recently played a leadership role in the development of the clinical community linkages model, which utilizes the role of community healthcare worker to assist individuals and families overcoming barriers related to social determinants of health. And Ms. Peacock is also president of the Michigan Association for Local Public Health, which represents Michigan's 45 local health departments. District health departments are organized by local governing entities, which are the county boards of commissioner. And there's currently two very significant public health crises in Leelanau County. The first is COVID-19, which will be today's topic. And the other is racism in all of its forms. Yet in this week's Board of Commissioners meeting, the political majority tried to install a person to the Board of Health Committee who is a well-known anti-masker and simply refuses to admit their own inherent racism. Fortunately, that did not happen. So please pay attention to the BOC meetings and support our commissioners. And please, let's welcome returning friend of the show, Lisa Peacock.
Thank you, John. That was such a nice introduction. I'm so happy to be here with all of you. So thank you for taking all this time. What a great attendance on a Saturday morning. When I talked to Sam about the meeting, what I suggested was that we do what I did last time, and I'll read a statement that I've prepared for the week. It'll give you a lot of information about our vaccination planning efforts. And then I am happy to leave lots of time for questions. She also thought that you might want to hear about public health advocacy and some channels that might be helpful in that. So I'm happy to fill you in on that a little bit as well. Does that sound okay? Okay. Excellent. I see the thumbs up. All right, so I'm going to just pull up my statement and we'll start with that. So this week, we are vaccinating healthcare workers in every county. All of Priority Group 1A is open and encouraged to schedule appointments by visiting our website, and I will talk a little bit about our website today. We're having some problems, and filling out our online form. We have widely shared an electronic form that will automatically put individuals and practices and businesses into the queue for scheduling. And through this means, we will reach out directly to these contacts to initiate scheduling. After the announcement this week that some people in Group 1B, as well as people 65 and over, will be eligible starting Monday, health departments, hospitals, and provider offices all over Michigan began experiencing a crippling number of phone calls and website traffic. We urge the public to use all the means available, meaning different websites across the region and the state. And this process of electing ahead of time will allow us to move forward more efficiently. And I will show you that form today. We will then reach out directly to schedule appointments when we are ready. We pull in groups of people at a time. The volume of calls that we are receiving is taking staff time and slowing down our ability to schedule appointments into the clinics that we have open. Our local hospitals are expanding their vaccination efforts at the same time, and we are working closely together to ensure each scheduled and staffed clinic is filled. These clinics require appointments due to the fragile nature of the available vaccines, as well as the need to maintain safety through distancing and gathering sizes. It is our goal to vaccinate the community as quickly and as safely as possible, including second doses administered within the required time frame. And we urge everyone to be patient and understand that this process will take time. While we are working together with our hospital partners to finish vaccinating healthcare workers this past week, we are simultaneously preparing for those in priority group 1B who will become eligible for vaccination Monday. This group will include older adults and some essential frontline workers. Hospitals, health departments, medical practices, and aging partners throughout the region are working to develop outreach plans for reaching seniors, as well as assessing any actual or potential gaps to assure that we reach the most vulnerable and meet their needs. In addition to the planning that we are doing to reach healthcare workers and seniors, we are also working closely with our schools to establish baseline information about their numbers and proper contact information to ease the scheduling process, and with local government as well to maximize our plans for vaccinating this sector of critical infrastructure. We are also working toward broadening the dissemination of information to the community through partnerships with community agencies and programs such as United Way, 211, and Community Connections. Our community health workers who work in the Community Connections program have filled a vital role in assisting the elderly and the homebound throughout the pandemic, and we know that they will help us reach those who may have barriers to attending traditional vaccine clinics. Recently, there has been a lot of focus on the numbers of doses that have been shipped to Michigan and the number administered so far. There are a couple of important points to remember about this, and that there is a natural delay in the numbers of doses administered compared to those shipped. Doses are shipped to the state every week and then distributed to local health departments, hospitals, and other providers based on requests where they need to be logged and properly stored before they can be administered. As mentioned earlier, clinics are carefully planned to ensure integrity of the vaccine and safety for the vaccination teams and those being vaccinated. Once doses are administered, they are most often documented in an electronic medical record, which then automatically uploads to the state registry within 24 hours. Then they are pulled into those numbers that are provided on the state website as doses administered. These steps naturally lag behind the arrival of doses in the state. However, the state is shipping doses to local jurisdictions through a weekly ordering process, and everyone who receives them is being held accountable with the goal of administering 90% of doses received within 7 business days of receipt. We have implemented several strategies to help us scale up quickly, including robust use of the Michigan Volunteer Registry and engaging the assistance of the Michigan National Guard, in addition to establishing contracts which allow us for partnership with other assisting agencies. We want everyone to know that every priority group is important. We have established regular clinics in our counties each week and are adding additional larger scale clinics on top of that. We are exercising full use of partnerships, volunteers, technology, and any other assistance to help us increase our capacity. The National Guard is coming to assist next week, and we have established a database of over 100 volunteers through the Michigan Registry that is growing each day. We will continue to follow MDHHS direction for opening up additional priorities and are striving to be ready as soon as possible after these announcements are made. We know that there will be overlap between groups and phases, and we will be prepared for the addition of new priorities when the time comes. Once again, we really need the help of our communities, which is why I am so happy to be here today. We need you to assist in disseminating accurate information, to maintain trust in this process, and to encourage patience. The first doses of vaccine arrived about 3 weeks ago, and in that time, thousands of people have been vaccinated across northern Michigan already. On our daily calls with hospitals and other partners, we continually adapt and update our process, building on best practices and lessons learned. And although this is a heavy lift, we are excited. COVID-19 vaccinations are the tool that we have been waiting for. The difficult mitigation measures, although they continue to be important now, are not sustainable forever. We need to keep marching toward that goal of vaccinating 70% of the population so that we can achieve the protection needed to move through the finish line of this extremely difficult time. So I will just add to that we are, this is a community. This takes a village, and it takes all of us to lift this effort off the ground. I'm talking daily with Munson Healthcare. We have a meeting every day at 5, and we have adapted our strategies every single day to make sure that we are in lockstep and assuring that we're using every resource possible. I know that there are lots of people in the age group of 65 and over that want to get their vaccine. The headlines that came out in the press releases from the state this week really made everyone excited, but also said everyone is eligible on Monday, and they do become eligible on Monday. But just to give you an idea of how many people we're talking about, when Munson Healthcare just ran their list of patients that are attributed to their primary care owned practices across their service region in northern Michigan, that was 65,000 people. So it's a big lift, and it's going to take a little while. All of the health departments are trying to be in alignment, and we are using this electronic form to allow people to kind of pre-register and get in the queue. And that helps us to build a robust database of people who are interested in being vaccinated, so that as we have clinics available, we can pull people from that list and get them scheduled. We're using an electronic scheduling method. So when we do pull people off that list, we send them an email link where they can get on and schedule, pick their time and schedule themselves. So if you have registered and you haven't gotten that email yet, your time will come. In addition, a really important partner that we've been working with is the Area Agency on Aging. And we met on Monday, and by the end of Tuesday, they had a hotline up and running to serve people 65 and over who may not have access to the internet or may not be technology savvy, that they can call and provide the same information. They had it stood up and running in 10 counties within 24 hours. So, we're really working hard together to make sure that there are lots of different ways that we can reach the people who need to be vaccinated, and we'll continue to work on that. Couple of things about the vaccines that we're using. We have both access to Pfizer and Moderna in our Benzie and Leelanau counties. And thank goodness for our partnerships across northern Michigan among our local health departments. That is what is allowing us to have both and to move forward without too much trouble with supply chain yet. There are only 2 health departments in northern Michigan that have access to the deep freeze storage. One is the Health Department of Northwest Michigan, and the other one is Grand Traverse County Health Department. And so those 2 departments, in addition to ordering their own allocations, are also ordering regional allocations of Pfizer vaccine. So Benzie Leelanau placed their order through Grand Traverse County for more Pfizer this week. We also have Moderna, which we can store in our own freezers. That one is a little easier to store, but that one is also a little bit more limited right now, as that is the vaccine that's been allocated to Walgreens and CVS, who are vaccinating the long-term care facilities and smaller congregate care settings. So we won't be able to get more of that until January 25th. So there are lots of different challenges. The deep freeze, both vaccines have to be very carefully planned for. These clinics don't look like our flu clinics. When we do flu vaccination clinics, that vaccine is very stable. It can stay in our refrigerator for the entire season. And when we do a flu clinic, we bring lots of extra doses, we guess high, and we invite walk-ins to come, and it's really easy to manage that vaccine. These vaccines are different. You can only open the deep freezer twice a day for a total of 60 seconds. Once you take the vials out, you can't put them back in. They then can be stored in the refrigerator, but only for 5 days. Once you access a vial of either of the vaccines, they have 6 or 10 doses depending on the brand. The entire vial needs to be used within 6 hours. So we have not wasted a dose yet. We plan our clinics very carefully in groups of either 6 or 10 so that we know we're using an entire vial at a time. And we also, on top of all of this, have to make sure that we're maintaining distancing and keeping people safe. And so it's just a different clinic flow than we've used in the past. It's winter, it's hard to do drive-throughs right now. And so lots of challenges, but we can do it and we're getting there. And I just want to say a big thank you to our Board of Health. I've seen Ty and Peachy on here today. I've seen Dr. Conley on here today. We couldn't do it without you. Our boards of commissioners and our boards of health are just, they're our governing entity, and we rely on them to be informed, and they're so supportive. And our staff is just amazing. And it's been growing by the second as we've been adding people to help with this pandemic response. And they're amazing and they're working so hard for you. So big shout out to our public health workers. They're working really hard. So I'm happy to stop there and answer any questions or talk about any other subjects that you'd like to talk about.
Go ahead, Kim.
Thank you. Thank you so much for your great work. Do you have any projections on when we're going to be able to get past that first level of frontline workers and 65 and over? I don't turn 65 until the end of April.
Mm-hmm. Yeah, I can't give you a date. I wish I could, but I know if I do it, we'll be wrong.
I would never hold you to it.
What I can tell you is that we got through healthcare workers a lot faster than we thought we would. I thought we would be vaccinating 1A at the end of January, and we're pretty much done. So that has gone extremely well. And what we did find that we didn't know we would find is that the hospitals had way more capacity than they thought they would have. They started out really being willing to do just their own employees and then their own credentialed providers. But then very quickly, and like I said, these daily phone calls, what it was looking like this week is, okay, we have 400 appointments open tomorrow. Give me the list of people that you have accumulated and we'll call and get them scheduled. And so that partnership has been key. And I know that it will continue. They are starting to vaccinate their patients in their attributed practices, starting with the highest age group, so 90 and over. And that's kind of the approach that they're taking with that on Monday. So they're vigorously moving forward. We have the National Guard coming this week. We're starting to do some of the 1B population and finishing up just a few healthcare workers, but we will be every day adding to our list and scheduling. So from those databases, we're building both through the United Way and 211 hotline. They're collecting all of that information into a spreadsheet for us, and each of our health departments and our hospitals will get there soon. It was it was estimated to be a 20-week timeline to get to the phase 2. And so that was the initial estimate. And I think we're moving ahead of that. So I think we'll be starting 1B next week. It's going to take a while. 1B is a huge group, but I think probably, in February for sure, we'll be getting to definitely additional groups, people with underlying conditions and people in the different categories beyond 1B.
Thank you.
Lisa, we sent you some email questions too. Do you have those?
Yeah, I can pull them up. You bet. I did pull those up this morning.
Peachy's got her hand up too.
Sure, go ahead and ask. I'll pull these up and.
Okay, well, this is Peachy. I did put my hand up on the screen there. I had a call this morning, a text this morning from a local person here in Glen Arbor saying, I'm looking for the electronic form to sign up my elderly mother. I'm on the website, can't find anything. I said, there's a problem with the website that will take a few days to fix. Please call. And I think that we should put this number up on the screen, 231-715-5557. Am I correct with that, Lisa?
You are correct with that. Yeah, if somebody can type that into the chat, that would be great. That is
okay.
the AAA /UnitedWay/211 hotline. It is only open on business days though. So, they will get a message today, but they will
Okay,
call there Monday. And that's been a huge help to us, because our phone line will be open so that we can be, getting people in and scheduled in clinics that we're doing right now. So,
okay, so then this person continued and
Okay.
said, do you know if the vaccines are available for this coming week? And do we need to bring proof of residency? She is not a resident, but lives with them. And so does it have to be strictly residents of Benzie-Leelanau for Benzie-Leelanau, or can we sign up for anything?
So residency is not a requirement for the vaccine. We want to get everyone vaccinated. So whatever works out best for you. We do know that saying that comes with a little bit of risk. Certainly, you don't want people like traveling to a certain area just to get the vaccine. But certainly we have lots of people who are our residents here part of the year, and that totally makes sense to me. So, we are not going to ask for residency proof or anything like that. That's just not, it's not a requirement for eligibility. And
Okay, thank you.
thanks, Peachy. Let me just fill you in on the website. Our website crashed yesterday. We have had an inordinate amount of traffic to the website, and of course the website crashed. And so they have been working feverishly on it all weekend. My update today, it's not fixed yet. So we sent out an email to our distribution list last night just to let everybody know that it is not working. You can still get to the form. We included the form in that email, the link directly to the form. We have a link to the form on our Facebook page. And I was going to pull up the form just to show you what the form looks like if you would like me to. And then I can put the link for the form in there. Oh, there's screen sharing is disabled. I don't know if you want me to share that or not, but I would be happy to.
All right, let me see if I can figure out how to do that.
Okay, no problem. And I got to get to the link of the form anyway.
Sam, make her a co-host.
I know, I'm looking for her name. Tom, do you see her? All right, I see her. Okay, you should be good now.
Okay, let me see if I can do that. There we go. Okay, so this is what our form looks like. So the link will take you right to this, and I will cut and paste the link into your chat so that you guys will have access to it. But you can complete it as a business or an individual. So if you complete this as an individual, then it's going to ask you some questions, your name, your telephone number, your email address. Those are really important questions because that's how we're going to get a hold of you. It'll ask you what county you live in, and it will ask you what phase you're in. So if you're an individual and you're 65 and over, you're going to go here. If you're a healthcare worker, you're going to go here. And then that will bring you to the next questions. And then it will ask you again, what priority group. This just helps us to organize the information on our spreadsheet. And then you just submit it, and it will get you in our queue. And that's all we need. And that kind of gets you in our database. And that's what we pull from when we're scheduling appointments. So when we receive our allocation of vaccine and we know how many appointments we can do for the next week, we fill them right away by sending you a link. And if you can't do the link, then we will talk to you on the phone, or the area agency on aging in 211 will help you on the phone to get registered. So it's a work in progress, but it is definitely something that is helping us a lot. So I'm copying this link and I'm putting it into the chat right now so that you guys will have access to that form. And let me see, I'm gonna send it to everyone. Okay, that should do it. If it doesn't, let me know. And then, are there other people who have questions, or do you want me to go to the list that was sent to me via email?
Yeah, go to the list because I know those folks are here and they would like their questions answered.
Sure thing, you bet. No, I'm happy to do. Okay, so the first question is, having had an anaphylactic reaction to a flu shot in the past, I am wondering about the specifics as they relate to preparedness for this occurrence. I've heard that you are required to sit for 15 minutes or a half an hour to see that all is well. My reaction didn't happen for about an hour, and then I was taken to the ER, so I have concerns. Totally understand those concerns. Both of these vaccines have an amazing efficacy and safety profile so far. However, some people have had anaphylactic reactions. There are really no contraindications to this vaccine unless you are actually allergic to any component of the vaccine. The vaccine does elicit an immune response, which sometimes is exaggerated in some people, which is why some people have anaphylactic reactions. If you've had an anaphylactic reaction to a flu shot in the past, we are going to ask you to sit for half an hour versus 15 minutes in the clinic before we let you go. We've had a great partnership with our county EMS. They hang out there, they bring an ambulance and wait while we're having our clinic, and then they help us to monitor people after they've received their vaccine. I know that sometimes reactions are delayed after that, and I think you should be cautious when you have had an anaphylactic reaction to a flu shot. I would talk to your doctor about it. They may want you to pre-medicate with Benadryl, and then certainly drive to the vaccination clinic alone. I would have someone with you, so if anything did happen after the 30 minutes, we would take care of you. But it is not a contraindication. It does not mean you can't get the vaccine, just there will be some precautions. So I would check with your doctor, but I would certainly get vaccinated. The next question is, we have Leelanau neighbors who are 95 and live at home. How will they learn when vaccine is available, and where will they go to get it? Same question for my spouse and I, who are in group 1C. So good questions. So people may find out when vaccine is available to them through a variety of measures. One is if they are a patient of a primary care provider practice who is owned by Munson, they are running their own list and doing their recall of those patients right now. So you may get a call from your doctor's office saying, we have availability. Would you like to be vaccinated? And here's an appointment time for you. Go to this clinic. They may hear from us when we get through, when we get through some more people on our list. And, certainly the folks who are older and live at home, I'm not sure how able they are. We want to keep our folks safe. And so we're looking at a variety of ways to reach them. And we're looking at a variety of ways of holding our clinics. Ours are not super huge numbers in Benzie and Leelanau County. We just don't have giant spaces to hold clinics like that. And they're very distanced and safe. So if they're able, they may just get scheduled into one of our regular clinics. We started at the health department, and then we moved to the Suttons Bay High School and the Lake Ann Methodist Church Community Center to give us a little more space and allow us to see more people. So they may hear from us, they may hear from the hospital or their provider. We are also, the health officers of our local health departments in the region are meeting next week again with the AAA and all of the COA and senior services directors in the whole 10 county region. And so there will be some different strategies in each county through senior services and places like Share Care of Leelanau County to reach out to seniors. So there will be a lot of different options. And in terms of 1C, once our website is back up and running, and certainly the state MDHHS website, you really watch for public information. We share a daily update every single day. We just did a MailChimp subscription that we're doing, sending out a blast twice a week. We use our social media really frequently. The AAA has some funding for media campaigns, so we're probably going to put some information on TV and radio to reach people in the 65 and over age group and just the general public. So I think there'll be a lot of different ways that you may hear. And word of mouth is really important too, so I'm glad you're all here today. And then the next question is, what does contact tracing look like for Benzie Leelanau, and how successful has the health department been in quarantining exposed individuals and groups? So our process is, we have a team of case investigators and contact tracers. We have built that team up throughout the pandemic because we've been really busy in that work. And so we've brought on a lot of temporary employees, which has been great. Some nurses in the community that wanted extra hours, or people who have retired and are able to work from home. Some of our great Leelanau County nurses are helping us with this effort. And generally, when we're notified of a positive result, we contact that person, we initiate a case investigation, and part of that case investigation is identifying their close contacts, which are people who have been within 6 feet for 15 minutes or more. And then we either contact those contacts directly, or we push them to MDHHS, where they have a contact tracing team who then reaches them directly. And then they're monitored throughout their 10-day quarantine period, or 14 days, depending on what the situation is. And I think it's been very successful. I think people, for the most part, have followed our instructions and have been very committed to protecting the community. So we're still busy. COVID-19, we're happy that the vaccine is here, but this is not over. All of our counties in all of our regions in the state of Michigan continue to be in level E, which is the highest risk level. And are rising in the region. Grand Traverse County told me yesterday they had 100 cases yesterday, high for them. We're running usually in the 20s a day, and that's pretty high for us. So we are still seeing lots of positive cases. And one caution I received from MDHHS yesterday was just not to let our guard down with testing. People still need to be tested, and the Bureau of Labs at the state is still really watching. There are some new variants of the virus that haven't necessarily made their way to our area yet, but are concerning. And so, all of the PCR tests that are collected and, all of the information that we're gaining from testing people is helping to keep an eye on the situation. So there's still testing widely available across the region, and we should definitely be continuing to test if we have symptoms or exposures or any other risk. And then there's a list of questions here that I'll go through. How many times in the past months has Lisa or anyone from BLDHD directly interacted with either of our elected state officials, Vanderwall or O'Malley, or their staff? What a great question. I wish that I had time in the last 9 months to be able to do that. In normal times, that's a really important part of our work, is legislative advocacy, and we have an advocacy schedule. And we, provide regular updates for them, and we try to meet with them either in Lansing or when they're in the district. We attend coffee hours. We have not had time to do those things over the past 9 months. I hope that they are subscribed to our daily updates. I know lots of legislators are across the state, so I certainly hope that they are. And if anyone in the community wants to encourage them to do that, we would really appreciate that. I know that our US Congress people are generally subscribed. They check in with us every now and then, and certainly, respond to different things that we put out. So the next question is, how many times in the past 9 months has either Vanderwall or O'Malley or their staff reached out and contacted the Benzie-Leelanau District Health Department and asked for their direct input? And I don't know. I don't know that they have. I know that I have been on calls with Representative O'Malley for different things, but other than that, not really direct. I have not been asked for my direct input. And then the next question is, apparently 40% of eligible nurses and mid-level providers in the Munson system have declined COVID vaccination. What is BLDHD doing to mitigate this? And what is BLDHD doing to actively promote vaccination in the general public? So I'm thrilled that I'm not thrilled that our website crashed. I'm thrilled with the traffic to our website. I'm thrilled that my email box is blowing up and my voicemail is blowing up with people that are interested in getting vaccinated. That's a great problem to have from a public health perspective, that there are so many people in the community that want this vaccine. I would way rather have that problem than the other way. Munson they have actually vaccinated about 60% of their staff now. So that has changed over the past week, and they have addressed vaccine hesitancy with a great webinar that they put on, and I'd be happy to share the link to that as well. I really, really liked it, with the infectious disease doctors talking about the safety and efficacy of the vaccine, and some of the ICU physicians to address vaccine hesitancy among their staff. I did share that with all of our staff as well. I have seen, just with both of my departments and the general survey that we sent out asking people to express their interest or not in being vaccinated, that some of our staff, many of our staff said, not right now, but maybe later. And we had about a 68% uptake, maybe a little higher at Benzie-Leelanau, 70%. But in talking to them, because we did ask them to sign a declination form if they didn't want to get it right now. In talking to them, a lot of them were really feeling like, I just don't, I want to get it. I just don't want to step in front of somebody else, or I just want to kind of see how things go and then I'll get it. So I think we're having more uptake every day. And as more people get it and more people do really well after it, I think that there's more, that hesitancy is slowing down. I really think, I told somebody this yesterday, that in my gut, I feel like we're going to get through a lot in the next month. And in the next month or two, I think we are going to be facing a different issue, and that is hesitancy among those who have not yet been vaccinated. And we'll be working on different strategies to deal with that. What are the plans for communicating the availability and schedule for vaccinations to the general public? I think I already addressed that. What are the current cost estimates for vaccination of eligible Benzie and Leelanau County residents? There is no cost to there's no cost for the vaccine. We do collect insurance information because we do bill insurance, if you have it, for the administrative fee. HRSA has also provided funding for those who are uninsured to reimburse health departments, hospitals, providers for that administration fee. And that helps to cover the cost of our staff time that it takes to do this. The next question is, has the BLDHD received additional funding from the state or federal government for vaccine distribution? If so, how much? We just got our first allocation of funding yesterday, or we got notice of the award. We have not received the funding yet. And it's funding for January through June, and it's $64,000. So, we are extremely underfunded, and that is not enough to do this work. So we certainly are billing for the administration fee and doing whatever we can. As we incur expenses, another option that we have in front of us, because we are in a pandemic and in an emergency, we can request a FEMA reimbursement. So far, so good. We've been able to cover, we were able to close out fiscal year 2020 without, being in the hole or anything like that. But, it does take, it comes in bits and pieces, and we never know how much is coming, but we have to go forward anyway. So we do, and we track our expenses, and we know that we will get reimbursed eventually. And then exactly how many doses of both vaccines, Pfizer and Moderna, have been allocated to Benzie County residents in 3 counties, and in the 3 categories, and how many to Leelanau County? I don't have the exact numbers off the top of my head for this. We put in our order this week. We did get, our initial allocation was 300 of Moderna, and we did 100 of Pfizer initially when we did our first EMS clinics. And then we have, and I think we're close to having used all of that. And then we put in an additional order for Pfizer, which will be received on Monday. And that is to cover our clinics this week. We can only request 1 week at a time. And I'll tell you that MDHHS yesterday, Thursday, we have to order by Thursday at noon. MDHHS receives the orders, and they get their allocation from the feds at 6 o'clock Thursday night. So then they take all the requests that have come in from the health departments and the hospitals, and they try to match up those requests with what they've been allocated, and they ship it out on Friday morning. So they work through the night to get it out on Friday morning, so that we receive it on Monday, so that we can cover our clinics for that following week. I can tell you, they told us yesterday that they received a request for 270,000 doses, and they had 60,000 doses to allocate. So that's, you know, that's tough. That's a really hard situation to be in. We hope that allocation increases from the feds eventually. It sounds like it will be loosening up a little bit, but that was the situation yesterday. Benzie Leelanau got what we asked for, so we will not be canceling anything we planned for this week. And I'm sorry, I don't know the number off the top of my head, but I think we're planning on vaccinating. I think we have 400 appointment slots this week. It could be a little more, it could be a little less. And then how many of these doses have already been administered? I close to 400. I don't have the numbers from the clinics that were done at the end of the week yet, but I believe it's close to 400. And then what is being done to prevent dose wastage by failure to administer doses by expiration date and time? I think I already talked about that. Our goal is to not waste any doses. We plan our clinics to use every dose in the vial, and then we keep a backup list of people who would like to be vaccinated and can come in at short notice in case we have someone no show and end up with an extra dose at the end of the day, which has happened. And we call people in off that backup list all the time, which is all the more reason that we want to have a really robust spreadsheet of people that want to be vaccinated so that we can continually increase. And I will say that, you know, our distribution so far, it's been building each time that we've done a clinic. And this week when we bring in the National Guard, and we've requested the National Guard going out a few weeks through February, they really help us to increase our capacity. So it'll just continue to grow. And that's all I have pre-submitted.
Well, we've got several here. Berta, you have your hand up. Do you want to go?
Yes, thank you. So my question is, so I'm sure that you still need more volunteers. How do you go about volunteering? What kind of volunteer work are you looking for? And then my specific question is, I'm a retired nurse and I could help give vaccinations. And so I'm wondering what kind of help you need and what can we do to facilitate that?
Yeah, that's great. Thank you. We have a process for engaging volunteers, and that is through the Michigan Volunteer Registry. So if you go to the michigan.gov website, and again, this is a link we usually have on our website, but our website is down right now. So you have to go to michigan.gov/coronavirus, or even just Google Michigan Volunteer Registry. It will take you there. You can sign up online through the registry. And we can run queries on that registry, which we are doing every single day. Debbie Aldridge, one of our supervisors, is our volunteer coordinator. And so she runs queries, and that information comes to us in a spreadsheet with everyone's contact information, credentials, what they can do. We like using that registry because it just is a database that's already in place that we don't have to build. And it does a very basic vetting. So it does a little iChat background check, and it does a credential review. And then, you know, we will look at that spreadsheet and we'll fill volunteer holes based on that. And so we need help of all kinds, but not just people to put shots in arms. We certainly need help with greeters, runners, all kinds of stuff. So please do, and pass it on.
Okay, next question. If you make a mistake and put yourself in the wrong category, are you able to go back and correct your form?
I think you can. Or just submit a new form and indicate that you're submitting a correction.
Okay. Next one would be, if you've already signed up to the 211 access, is it best to not fill out the form to prevent redundancy?
Yeah, it really doesn't matter. You could do both, and that would be okay. We are cross-referencing. We're getting that form from 211 regularly. And again, Debbie Aldridge is helping us with that part of our response. And so we're cross-referencing those forms. So we'll get you either way, but if there's redundancy, it's okay.
Okay, then the next one is, how useful has the exposure app been?
I have the app downloaded on my phone, and I've never gotten anything from it. So I'm not so sure. You know, both people have to have their information in there and be signed up for the app for that really to work. So you know, I'm not sure overall how effective that has been across the state. It's another tool in the toolbox, not the only tool, but another tool in the toolbox.
Okay, then the next question would be, where and how do you get a test locally?
Yeah, so there are lots of places you can get a test. There is a test finder on the MDHHS website. Normally, I would direct you to our website, but as I said before, it's having problems right now. You can go to the test finder on the MDHHS website. I know that some of our local testing sites fell off for some reason, and now they're back on. But NMHSI, Northwest Michigan Health Services, Inc. has been a really incredible place for testing. They're testing in our Benzie and Leelanau counties. We do some testing at the health department in Leelanau County as well. You can call our main health department number for an appointment. You can get tested at a couple of the urgent cares in Traverse City. You can get tested through the Grand Traverse County Health Department. They have a testing center at the Cherryland Center. There's widespread availability for testing, but I'd suggest the test finder.
Okay, the next question is, how might someone donate their stimulus dollars to the BLDHD?
Oh, wow, how kind. That I would put you in touch with Dodie Putney, our administrative director, who would be able to help with that.
Okay.
Email me. You could email me too. We did just receive a generous donation from a resident, and that's great and very, very grateful. Thank you.
Okay, then the last question I have in the chat that you have not already addressed, and I'm not going, for everybody's information, I'm not going to repeat questions she's already talked about. Is there any updated information regarding if a vaccinated person is contagious to an unvaccinated person?
So the mRNA technology that was used to make this the vaccine is amazing, and does not, you cannot get the virus from the vaccine. That is just not possible for that to happen. So, and you know what, it's really well explained in this webinar. I'm going to type in the webinar for the Munson, that the Munson infectious disease doctors did so that you can have access to it. It's really very well done. It's only about 30 minutes. So no, a vaccinated person is not contagious unless they actually get the illness. Now, no vaccine is 100% effective. And this one is not it has 95% efficacy, but not until about a week after your second dose. So certainly people could still get infected with COVID in the meantime, and then they could be contagious, but it's not from the vaccine.
Okay. Now I need to tell you that link that you copied and put into chat did not go into the chat.
Didn't work.
Didn't work. So if you want to, you can either send it to Sam and we can get it out to everybody. And that's the last question we've got on the chat that has not already been covered. For those, as an information, there are several people who have put in websites for volunteers, et cetera, et cetera. So people, if you're interested in volunteering, check the chat, because that information is there. And they worked this time, Lisa. There it is.
Oh, good. I think I never hit enter. So I think that was
So
on my part.
okay, her link is now in the chat. And Sam, back to you.
All right. Thank you so much, Lisa. Let's everybody give Lisa a big round of applause. And we will be working for advocacy for money for our health department. You can count on us. So,
well, and I do want to, and I will put this in I'll put a link to this form in the chat as well, or I'll send it to you, Sam. But I do, there is a document that I think would be helpful to you in advocacy. I'll just show it to you real quick and then I'll get off. But I think, just local public health in general is underfunded in the first place. And this is a little bit old. It's pre-pandemic, but it still applies, and I'll scroll down. This just talks about local public health often is working in the background, not so much now, but that, all these things that keep us safe don't just happen. It's because of the work that we do, and that we're threatened by chronic underfunding. And one of the things that we were very underfunded for was communicable disease management. It's the littlest, tiniest bit of funding that we get. And in this, at this time in 2018, we were talking about hepatitis A and measles being on the rise. Well, now we've seen what can happen with a major pandemic. And so we have compiled this information about the return on investment for local public health. For every dollar invested in some of these services, this is the return on our investment. So this might be helpful to you. It's American Public Health Association and Michigan Association of Local Public Health data. and, what things might cost if we didn't have public health interventions. And then one key point in Michigan is that for the past, long time, 34 years, we've had a law in Michigan that requires a 50-50 sharing of costs between the state and locals. And for the past 20 years, the state has not funded the statutorily required level. And so, this is really important information for our legislators to understand. We go and sit with them and explain this to them, but they change all the time. They turn over all the time. So I want you to know this information because it really is important. There's a loophole in the law that just says that it is required to fund that 50%, but only if the money is allocated in the budget. So you can see how that loophole plays out at the local level. We know everybody's facing difficult budget years right now, but this is not the time to underfund public health. It's the time to, robustly fund it. So I will send you this as well. And I thank you all for your time today.
Thank you so much, Lisa. Bill, we have just a couple more slides with a couple honored guests that are here today that I was hoping people would have a chance to hear. Okay, we have Haley Hildebrand here. Haley, she's Governor Whitmer's new rep in Traverse City. Would you like to say a few words? I know something's happening about funding right now in Lansing, if you want to talk about it.
Yes, I'd love to. Thank you so much for the invitation, Sam. And thank you, Lisa, for all your work. I think our entire region is just so lucky that we have an incredible public health department, and they are truly our leaders on the ground working tirelessly to make sure we can move forward to a new normal. So thank you so much, Lisa. And I look forward to continued conversations. So yeah, my name is Haley Hildebrand, and I am Governor Whitmer's regional liaison. I'm really excited. This is the first time any governor in Michigan's history has created an office specifically for the entire lower region. It's normally been one person in the UP trying to cover our whole territory. And so I'm really excited that I live here in Traverse City, and there will be a physical office when we can safely gather again. But I'll be sure to leave my contact information in the chat so you can reach out to me. But I really look forward to working with this group and talking more. I did want to share too, yesterday there was a statement made by our incoming appropriations chair, Thomas Albert, and he was appointed to this role by Speaker-elect Jason Wentworth. And he made the bold statement that the legislature would not consider moving forward on allocating federal COVID relief funds unless the governor fully opens up the economy, which is a completely reckless and dangerous statement to make. And if any of you tuned into the governor's press conference yesterday, she did answer that question in a very eloquent way, as she always does. But this is just simply unacceptable. And since it is a Saturday and I'm on my personal time, I can be a little more politically engaged, that we do need to put pressure on not only our own representatives in the House to make sure that they are not signing on to this dangerous rhetoric, but also to Thomas Albert's office, and just know that the public is aware of that this statement's being made. We're monitoring to see if any other legislators make statements or sign on. At this time, it's only him, but he is our appropriations chair, which, as you know, is a very important position to be in. And our federal COVID relief funds, a huge portion of that funds public health and vaccine distribution, increased testing, continued testing, also funding for broadband so students can access their education. The list goes on and on. As you know, if Donald Trump can sign off on these federal funds, there is no reason why Michigan should block them. So the governor's taking this seriously and we're all monitoring, but a call to action could be reaching out to O'Malley, making sure that he's not pushing the same message, and just knowing that the governor's not going to stand for our federal funds being held hostage. Everyone wants our economy open. We all want to return to a new normal, but not under these circumstances. And she will never compromise on public health and the safety of Michiganders. And she is staying strong on that. So stand by on that news. And in terms of vaccines, she did send a letter with some other governors throughout the country to the federal administration urging for more vaccines. As Lisa mentioned, the state's getting about 60,000 a week, which is significantly less than the number needed to make a significant impact. And she will continue to make that request very boldly. And let's hope that come January 20th, we can have a national strategy that can be effective, because right now it's every state for themselves, and the states left to make sure that the counties are prepared, and they've done an incredible job. So thank you again to Public Health, and I look forward to keeping in touch with this group, and thank you so much for having me.
Okay.
And Phil, our next one. Is that Barb Conley next?
Yes.
Yes. So Barb Conley, Chair of the Leelanau Dems, is here, and I know she would like to have a few minutes too.
Well, thank you, Sam and Indivisibles, for giving me a couple minutes, and I'll only take a couple minutes. We have so many things to address. And the Leelanau Dems, myself, co-chair Bridget Hart, and others, of course, are very grateful for what Indivisible had done during this last election. But of course, we have to gear up for 2022. And it's very important. Those of you who are not signed up for our newsletter, I'll put our email in the chat. Give us an email. We'll sign you up for the newsletter. We are going to be having extra speakers now and again, which will hopefully complement the ones that you all are calling to your monthly meetings. But we need local candidates. Any of you who want to run for local office, it's very important. Local office is arguably more important than national office. And there hasn't been a lot of Dems wanting to run for township and school board and other things that are very, very important. If you want your principles to get in action, that's one of the best ways to do it. Regarding the races, so we are on it. We, as you know, the 101st, we are part of the 101st State House District, which Jack O'Malley currently represents, and theoretically he will be running for the next term. So we are hopeful that we have a couple of people interested in running for that. And also State Senate District 35, now occupied by Vanderwall. Now, they are not term limited, either one of them at this point, so it might be a challenge, but you know, who runs from a challenge, right? And then the big thing, Congressional District 1. Now, all of the Northern Democratic parties are working hard to get a candidate ASAP for District 1, because there's a lot of preparation for that. Bergman's activities over the last couple weeks, month, have been reprehensible. Lots of people want to hold him to account. Best way to hold him to account is to send him back to Louisiana. So anybody interested, please get in touch. I'm going to put it's LeelanauDemocrats@gmail.com. There's a website. I'll put that in, and you can call us or drop a line in there. Anything, any ideas you have, and especially if you're interested to run, there's a lot of training coming up that that can clarify your thinking on that matter. So thanks, Sam, for the time. I really appreciate it.
Thank you, Barb, for the important work you do, and I urge everyone to join the Leelanau County Democratic Party. Next up, I think we have Ty Wessel, one of our commissioners.
Thank you. I'm blown away by hearing about all of the efforts of Leelanau Group over the last 2 years. Thank you very much. Also blown away at seeing all the work that Lisa Peacock and the Health Department are doing. And I feel so fortunate that we have both your group, the Indivisibles, and the Health Department here. Sam asked me if I wanted to say a word. The most important thing I think I can tell you today is that your public comments, your letters and your public comments are listened to and make a difference with the county commission. And we did make a big change, I think, at the organizational meeting. We're going to move the public comment agenda item to the beginning of the meeting so that speakers will know when public comments are and don't have to wait through a number of presentations. We do need public comments. We have placed the anti-racism resolution back on the agenda for Tuesday for further discussion. We got to keep that on that agenda every single month until we make some real progress. We also have on the agenda on Tuesday a discussion of our goals. It's a slow process, but when we're done, we want to make sure we have some environmental things on there, some anti-racism things on there, some early childhood things on there. So please come, let us hear from you, and don't be afraid to take us on. Thanks a lot.
Thank you so much, Ty, for your work. That man deserves a case of beer every week. Linda Pepper, are you still here?
Yes, I am still here. And what I wanted to speak about for both Indivisible Traverse City and Indivisible Grand Traverse is we had originally thought this week that we would be doing some picketing along the Parkway this Sunday and Monday. But we decided that with the volatility of the situation that we're looking at, we're not going to do that. We're going to reevaluate next week and see if it would be helpful to do this. And I will go ahead and let Sam know if we decide and ask her to put out some information on it. But we just decided discretion was the better part of valor on this. I am so proud of Nancy Pelosi standing up and saying, this guy's got to be held accountable. And I appreciate her so much. And we want to say that our elections were fair. Bergman needs to go. And we need to be done with this kind of craziness. So thank you very much for John and I. He had to go to another meeting. So quick and short, and we'll let you know what we're going to do.
Thank you so much, Linda. I love working with you guys. And now Peter Raphael.
Well, as the last person on you.
Oh, you know what? I just forgot something, Peter. I forgot coming attractions.
Okay,
So,
well, take it away.
Phil, do you want to do coming attractions? Sorry, Peter.
DM?
Yes. Oh, yes. So our coming attractions, our next meeting is going to be Melissa Petoskey talking about successful social movements. And we're really going to build our goals and work and think about 2022 and work on that. Kate Sturkin is working on an incredible Leelanau Indivisible website. Kate, do you want to say something about that?
People bailing out.
Yes, I am excited to house and have a place for all of us to learn from each other and keep aware of what's going on in our county. So I am building it out now, and hopefully we'll have it up and running to start using it. It will also have a calendar, so hopefully that's helpful as everybody's planning and trying to attend all these various meetings.
Thank you, Kate. It's a lot of work you're doing, and we really appreciate it. Okay, now Peter, sorry.
Well, what I was about to say is that being the last person on the agenda, I've learned you need to be really quick before everybody decides to leave. So I will be very quick. First, thank you all for attending. It's very important that we continue with this work. You've heard so much, not only locally, but what happened in Washington this week, where we all can contribute something to this. So please come back next month for our meetings. In the meantime, invite people you know who might be good to join us. Do the things you can do individually to contact local as well as state and federal representatives and make sure our voice is heard. The last thing I would just say is for your own personal sort of edification and maybe some more information. Megan and I have been reading a book recently that we found or heard about. It's called On Tyranny. It's by Timothy Snyder. Many of you may have heard of that. I put the name of the book and the author. It's a very small but very powerful piece of work that, given the times we're living in, it's very important that we all understand what we can do personally to make sure that our democracy stays safe. So anyway, thank you all for coming. Have a good day, a good weekend, and let's just hope the next 10 days we don't see what we saw on Wednesday.
Thank you, Peter. Goodbye, everybody. Have a good day.